sensory issues, light, noise, sometimes label, texture. That's why some people they can only eat a particular food and they can't eat any other thing, you know. And they do have unique mind because some of them like to run off to do their own thing to the distress of their parents. That's autism in a nutshell. And there's a lot of stereotyping, we stereotype. Oh, all autistic people are stereotyping me, we are generalizing. We say sometimes all autistic people are very intelligent, they are stubborn. With one Rain Man, people will tell me, everyone's a good doctor, like all of them have those minds. That generalization. Some people will say, oh, autism is poor parenting. Just give me 1 week, I will straighten that child out. Some people will say, autistic people, if they try, they can be like horse. They are just acting up. Hmm. That's generalization, isn't it? We have our own ideas of what autism is. Many of us, we've not taken time to read about it, but we are specialists in saying what autism means. And even though they have these challenges or differences, some of them actually are very, very bright. They can memorize large information and remember it for a long time. Someone like Stephen Wilshire, who needs help with his personal care 24/7, has been described as human camera. He was taken to the Vatican by plane and he came back and he drew everything, all the details, just by seeing the place. Someone like Einstein is believed to have been autistic. Elon Musk is believed to be autistic, and Tesla and all the other things are there to show. Some of them are quite calendrical. If you give them any dates, they will tell you the day of the week it is. Some of them identify patterns. Autism and the Black community. Parents who are infected, in quotes, with autism, which children have autism, they have issues on different levels. First, you have from your fellow Africans thinking maybe your child is possessed. I've heard pastors say that before. I've had to ask Gio, Daddy Ginodu, this is what I heard. Is it true? Are they cursed? Is it spiritual issues? Is it punishment from God? Is it disobedience? This child that has this unique mind, is it because you didn't pray enough? Because people will come and meet you. I remember one of my friends, I have two children, both of them are autistic. So I remember one of my friends telling me she has like 4 schools in Nigeria. She has like 4 masters. Now she's doing her PhD. And she said somebody came to meet her and said, Sister J, you've been sleeping. And she said, what do you mean I've been sleeping? Said, you have been sleeping spiritually. Said, why are you saying that? He said, because if you have not been sleeping, the devil will not have come into your house. And why? Why did he feel devil was in her house? Because she has an autistic child. So most families, they isolate themselves. Anyway, some people will even make you feel like your child has a contagious infection. So they keep their children off. You know, you get isolated, isn't it? Because when some functions are going on, because some people just think, oh, it will be too much trouble. Let's not invite this family. As the reality. Misunderstood, because sometimes a parent is just overwhelmed. If she's not out there socializing, it's not because she doesn't want to socialize. But imagine, before you go out, you tell your child like 20 times, when you go there, don't touch this, don't do that, don't get up there, don't run off, don't do this. Every scenario, you've played it in your mind. And then you get there, and people make you feel like you have PPS. That's poor parenting skills. Isn't it just easier to just stay in your house? You've gone through all these things in your brain, and then that's all you get. And most people just feel unsupported. You know, you see a child doing all sorts. Sometimes you say, leave him, leave him. Everybody is in this place, your child is there. It's easier for them, but then he's not getting the socialization that he gets, he needs. That's the reality. That's one area. Then you see, you have educational system. If you go into any support group for children, family with autism, one of the words you hear a lot is fights. Not for special things, but for basic things. The school sometimes will say we can't meet the need of this child, this mainstream. The council will say we have assessed this child and the panel has decided that that mainstream school is what is best for the child. So your child is in between. If you know the number of autistic children that are out of school in this country, you'll be amazed. And then nobody understands the struggles that many parents are dealing with. And then the ping pong starts. You start to write the council. The council is saying, no, tell the school if they need more support. The school is saying, no, we can't meet the need of this child. And then they say people who are autistic, many of them have mental issues. It's not the condition, it's the conditioning. Constantly feeling like you are broken, constantly feeling like you have to be fixed. They understand the theory of mind. Most people feel they lack empathy, they don't understand, but they do. And then they see the struggle that even their parents are going through just for them to have education, basic human rights. And the world looks on. They say the world does not stop for your good. The world looks on. And then you also have the medical side. I know we have the doctors in our midst. But many of them also don't understand what autism means. I remember one time I took my child, one of my children, to the doctor, and she was excited because of all the things in the GP's office. And the GP said, oh, did you come with someone? I said, yes. He said, what? I can see you came for your child. I said, yes. He said, did you come with someone? I said, yes. He said, can you take your child to that someone? So I took the child out. And I said, oh, he's more quiet now. What is wrong with the child? I said, have you started practicing medicine back proxy now? I am not your patient. How are you going to know what is wrong with your patient if you do not examine the patient? And that's what parents get. And I know that at least I passed through school a bit. And I keep thinking, if with the little I know, I'm facing this, the people who do not know as I know, what are they facing? That's the reality we face. And then it's not exempt from church. Sometimes the noise, Is not conscious. But a child wants to go out because the noise is too much or the light is too much, and then we just think, oh, this child is very naughty. No, I remember when I was doing a course and they were talking about people with dementia, how they why they have confusion, and they made us wear these earphones, and you could hear everything, everything. And I'm like, why won't you be confused? As in, this is the life some people on the spectrum are living, where the sound, everything happening about around them, they can hear it. It's a law. So, what can the church do? We need people who have children who are developing not developing according to the expected milestone. We need them to go out and get their child checked. We always say, it's not my portion. Yes, that is ideal. But what about the reality? What about if that is not what is you are facing? Early intervention is so key because it helps the child to learn social skills, the ability to communicate, they learn and they are able to achieve more in life by just having that early intervention. And it's been seen that African children are diagnosed much later than their white contemporary. I listened to one autistic adult, a black person, and he said, "Today I'm going to this." He was talking in University of Sheffield. He said, "You have always labeled us. Today I'm going to label you. You've always labeled us black. Today I'm going to label you white." And it's been seen that people that are Africans, black, they tend to be diagnosed like 2 years later than their mates. And one of the reasons they found out is that our children are adultified. What do I mean? If a little boy that is Caucasian does something, oh, he's being silly, let it be a black boy. Oh, he's aggressive. He has anger issue. This child is just three for crying out loud. And so when they start to check, if it's a Caucasian that is doing that, they start to check, could it be that he has this autism, ADHD? Our own is anger issue. Your child is aggressive. So we need to help people stand up and get early intervention and fight. Yes, it's a fight, but you need to fight. And what can the church do? Leadership. Are we talking about this thing that is happening round around us? We need to talk about it. We need to make sure that the church, sometimes it might even be important to find out if they're autistic adults who can come and check the church environment. Is this conducive for people who are on the spectrum? I remember listening to someone, she's one of the UN ambassadors, and she's autistic. She's married, she has kids, and she was saying, if at any point I'm talking and you feel like applauding me, don't clap, flap your hands because of the people who are here who are autistic, their sensory issue, you are making too much noise by clapping. Just flap your hands. So when we also see people doing things, let's not look at it just from our own points, our own perspective, that they are making noise. Look at their world. In their world, what does it mean? Eye contact. Right now, we are saying one of the issues we also have with with the services that we have is that they are not culturally sensitive. I don't like looking at people's eyes. That's the way most of us were brought up. It was considered rude. And for me, it's not an issue if my child is not making eye contact. It's not a priority for me. So it's important for us to also go out there, get our qualification in this field so we can speak for our own people, as against them telling us what is not relevant to us. You know, that's so important. Sister Irene has said I should share a little about my story. Okay, my two children, 17 and 18, were diagnosed when they were just 3 and 4. I noticed my son because when he was before when he was like 9 months, he started speaking, he started saying few words. But with time I noticed he started to lose those words. I didn't understand. And I took him to the GP. Oh, the health visitor. I went for health visitors check first. They said, oh, he's a very contented child. It's okay. There's nothing wrong. But I knew. And that's why I said to parents, trust your gods. I knew something was wrong. So I went back to the GP. I said, my son used to talk. He's not talking. I don't know what is going on. They started referring us. Before it was a little over a year, by 1 year or thereabouts, he had gone quiet, silent, shut out. He was not only not talking, he wasn't responding to his name. It was like he was there, but he was not there. I mean, I don't know how to explain that kind of experience. And then the health visitor came to visit us one day and they saw my daughter. She's always been very active. And they said, I think we need to refer her. Something is not quite right. And then one day, we were in Bromley then, in Phoenix Children's Center. We were called after all the professionals had seen them. And he said, we made the decision. It was a Nigerian doctor, Dr. Shuba. He said, you know what? God will never give us children we cannot care for. And so God knows that you are the best parent for these children. That's why He gave you these children. And the outcome is they are both autistic. And you know the interesting thing? It was like, shush, run along and sort yourself out. Because the day your child gets diagnosed is the day you are discharged from the service. Now you are meant to build a ship without even a map. And then you know that if you don't build the ship immediately, you are going to sink. So that's where the fight started. And then my son, the captain of his own ship, who liked to have many adventures, used to wander off. We and the police, we were friends because my son will just go from wherever he is, even in his preschool, he left. But amazing grace, they've come this far. What am I saying? The opportunity for growth is there. Yesterday when Reverend Aikoma was talking about Simon, Jesus going to the house of Simon, and the sinful woman was there. And Simon was saying, and the sinful woman was using her tears to wash his feet. And he was saying, if this man was a man of God, you know that this is a sinful woman. And Jesus said, I came to your house. You didn't wash my feet. You didn't kiss me. You didn't anoint me. And this woman did it. And wherever the scripture was preached, she will be mentioned. Until now, we talk about her. And so we, the church, we need to educate people. Stop demonizing people going through stuff. They're already dealing with a lot. We need education. Let's bring in professionals. Let's collaborate with the social services, the educational services. Let people come and hear what it means to be autistic, how we can support. Do we have support system in place for families that are dealing with this? It's important. It's important. I wrote a book a while back. I brought copies of the book for anyone who wants to buy. And it was when my son he was able to do his SAT. And I remember he had been at home for 2 years before. So year 4 and 5, he was at home. He went back in year 6. And it was like, how would this thing be? I told you about Fred Ball. I said he was an angel, didn't I? He was one of the people that they brought in to tutor him. And he started teaching him piano. And he said, oh, I think we should register him for grade 1 piano. I'm thinking, how do you register a child that will not even focus? Is it even, is it, by this time he was talking, but it didn't make sense. I said, okay, if you think we should do it, we should do it. And then we registered him for grade 1 piano exam. And we were preparing him for SAT exam. And my son went and he did the grade 1 piano exam. Honestly, the day as we got there, he started playing the piano. It didn't matter to me whether he failed or passed. To me, he was already victorious. It was overwhelming. Like, we got here, we did get here, and then that year, he did SAT again, and he passed. And I told one of my friends about it, and he said, oh, I think you should write an article and put it in a journal. And I wrote the article and I sent it to Sister Abiodun. And Sister Abiodun said, Sister Tony, I couldn't sleep. I was crying. We need to get this book published. And I said, okay. So I sent it to one of my friends that is a professor, is the head of a department. He said, we are not going to just say your story. We have to write about the lesson learned. And so I had to start working with GP, with psychiatrists, with speech therapy, with them, just to make sure are this information relevant? Are they up to date and all that? What am I saying? It's been a journey where the children can grow. And one on a final note, you know, Psalm 139, verse 14 is one of my favorite verses. It says, I am fearfully and wonderfully made. Marvelous are your works, and that my soul knows very well. So when you see an autistic person, remember the word maga. It's a unique mind. It's a unique mind. And you know what? They say people that you think cannot do anything end up doing what you cannot even imagine. Trust God. And if you know anyone that is in that position, like all an Aaron, lift up their hands. And you know what? That child will thank you because of that. Thank you.